Welcome back. We continue to deal with that poor air quality here in Kern County and much of the West Coast. And joining us to talk more about this and how it could impact our health is Dr. Nick Hanza, pulmonary and critical care doctor, to talk about the effects that this air quality can have on all of us. Dr. Hanza, thanks so much for joining us. Appreciate it.
Good morning.
Let's talk about it. It is another bad day. We want to show you some live pictures outside just around town showing you how bad the air quality is as we speak. Here's a live look outside downtown Bakersfield. We're going to show you some a look across town, including the mountains. But Dr. Hanza, we kind of had a nice weekend, if you will. The skies kind of cleared out for a little bit, but we're seeing unhealthy air once again in the forecast. And we've heard from meteorologists talk about how this is going to continue to be a problem until these fires are extinguished. What does this mean for all of us? Whether or not we have lung issues, just for the general public, what does this mean for us?
Well, when we inhale air that is, very, very bad in air quality, it impacts all of us. It's harder to extract the oxygen. It creates an irritation to the entire system. That's why symptoms such as sneezing, coughing, sore throat is just very common, even if you don't have any underlying lung disease. Now, if you have underlying lung disease, it even impacts you even more.
So, for example, I know that over the last couple of days, I've been just experiencing a little bit of a sore throat. But all of this comes as we deal with the coronavirus pandemic. And a lot of the symptoms that you just described are some of the symptoms of coronavirus. What is the main difference between these two? What are some of the symptoms that we should not necessarily be concerned about or maybe paying more attention to during this time?
Well, a very helpful hint would be just the timing of it. When we're outside and exposed to the air, and immediately after that, those similar symptoms would tend to be there. But when we leave the environment, such as come indoors in a filtered air environment, those symptoms should dissipate fairly quickly, especially if you do not have underlying lung disease. So that could be a helpful differentiation.
And of course, if you're not sure, should you just go get a test in general?
Absolutely. If you're not sure, we have multiple testing sites, and I hear that the state wants us to test more, so yeah, absolutely.
All right, I want to go back to the effects of this poor air quality, because this is something that we've experienced poor air quality in Kern County before. We'll have a bad day of air quality, and then it'll be good the next day and so forth. It kind of goes up and down. But we've been in this pattern of just poor air quality, not just for sensitive groups, just plain unhealthy, for several weeks now. Are there any long-term effects that could come from this?
Well, long-term effect, likely not unless you have underlying lung disease. But still, if it's long enough, it certainly will impair your ability to exercise, to do things in a normal fashion. And really, the risk of having infections such as bronchitis increases, even in the healthy group.
So what happens when, for a majority of people who are healthy, they don't have any lung issues, should they really not be exercising at all? Should we be inside during these bad air days?
Yes, when the air is this bad, the recommendation would be to stay inside. You can still exercise, but we should do it in an indoor environment where the air is filtered.
So that includes just taking a walk around the neighborhood, running, all of those activities?
Yeah, we would limit outdoor activities, including those when the air is this bad.
All right, so unfortunately, this is something that we're going to be dealing with for a while as these fires continue to burn. Dr. Hanza, thanks so much for joining us this morning to talk about this unfortunate topic. We appreciate it.
Okay, stay healthy.
All right, thank you.